Good afternoon, everyone. I want to welcome you to today's webinar, Transportation Providers, Services for Older Adults and People with Disabilities. My name is Melissa Gray. I'm the Senior Program Manager with the National Aging and Disability Transportation Center, and we are all glad that you have joined us this afternoon for this exciting webinar where we'll discuss our 2019 survey results. Before we get started, I do want to go over a couple of housekeeping items. I do want to remind everyone that this webinar is being recorded, as well as we will be taking questions at the end of this webinar. There is a Q&A box at the bottom of your screen. If you're on your laptop or desktop, you are welcome to start typing questions throughout the webinar as they come to you, or you can wait to the end of the webinar to insert your questions there. We will be addressing questions at the end of today's webinar. We do recommend that you connect to your computer audio. That is recommended. And lastly, you all should have received in our reminder email to you a link to the survey that will be discussed today. So if you did not receive that email, no worries. We'll be sending that out following today's webinar, along with the slides and the recording of this webinar. So at this point, I want to turn things over to Virginia Dyes, Co-Director of the National Aging and Disability Transportation Center.
Thanks, Melissa, and welcome everyone. We're so pleased that you could join us this afternoon. I want to emphasize a couple things. This is the results of a survey that was conducted in late 2019. We surveyed transportation providers and we asked them about services specifically for older adults and people with disabilities. This is a pre-COVID survey, but I also want to point out that the information that we gleaned through this survey, I think, is still very relevant today. And I hope that that's the way you all feel as well. We know that we've got some additional new challenges these days, but nevertheless, these are issues that are important for us to know about, and particularly to know about the perspective of transportation providers. There are three of us who are going to be presenting today. Mark Richards, who is Senior Vice President for Research and Insights at KRC Research, and they are our research partner. And of course, my fellow partner in crime, Carol Wright-Kenderdine, also co-director of the NADTC, works at Easter Seals. And again, I'm Virginia Dyes with NADTC, and I work at the National Association of Area Agencies on Aging. So with that, I'm going to turn it over to Mark right now. Mark?
Okay, thank you, Virginia. We have some really interesting data that you'll see in a moment, but let me give you a little background on how we collected this data and tell you a little bit more about that. So let's move to the next slide. So we conducted a survey nationally, and we conducted the survey online. This was an effective way to reach individuals who provide transportation services to older adults and to people with disabilities. We created a survey instrument and programmed it into an online platform that we distributed through NADTC, distributed through e-news subscribers, area agencies on aging, Title 6 Native American aging programs. And the link was also sent to the National Rural Transportation Assistance Program and National Center for Mobility Management. And we asked these individuals to distribute the survey additionally through their networks. And the beginning of the survey had a couple of qualifying questions to determine who qualified, and if people did not qualify, they were thanked, and those who qualified participated. And we had a really nice response. We fielded the survey between November 12th and December 9th, so it was about 3 weeks, and close to a month. And we had 219 individuals respond in total, and that represented a vast number of organizations, more than 200 organizations. So with that, let's move to the next slide. So The report and the information that we're going to share with you today focuses on the content that the questions and content that we collected in the survey. We looked at experiences that providers have with providing the services. We looked at their communications and public awareness efforts and activities. We looked at driver training and safety programs, coordination efforts, funding sources, challenges that organizations are facing and unmet needs that they're hoping to meet, and opinions about new technology in the future of transportation, what we can expect in the future. So we covered a lot of ground in profiling what organizations are doing and how they're doing it and what's going well and what they need. Now, if you look at on the next slide that I'm going to show you, just so you have a sense of the distribution of the respondents and the kind of organizations, probably many of you who are observing participated, you could see that we had a large 30% of the organizations are specifically in public transit, 21% work in area agency on aging, human service agencies. You can just look down the list there quickly and you can see that we've heard from the voices and the perspectives across many types of organizations. You can also see that the geographies, which are also important because there are differences in responses based on geography, as you're well aware. So we had, and these are overlapping to some degree. So we've got urban areas, 49% who serve urban areas and 50% that serve suburban. Some serve both, some serve different areas, different jurisdictions. So we've got, we heard from people who are serving all kinds of locations, from small towns to urban frontier areas and tribal areas. We also heard from people serving and working in different types of jurisdictions. So you can see people who are working only in cities or people who are working in single counties, multiple counties, regional areas within states, regional areas across state lines, statewide. So a vast array of experiences and situations that people bring to this research. We covered all of the regions, as you can see there, the TA regions. And you can see that the people that we talk to serve often overlapping both older adults and people with disabilities, but not all are overlapping, some are specific. We also looked at funding sources, and you can see that the organizations that responded rely on so many different sources for funding, and beginning with the state and FTA section 5310. Among others. You can look down the list there and see how vast that is and how critical it is to their to the activities. So that gives you a perspective on how we collected the data and on who we heard from. And I'll turn the conversation back to Virginia to share some of the findings.
Thanks, Mark. And Carol and I are going to be tag teaming as we report the results. I do want to emphasize that these are what we're going to be presenting this afternoon, are highlights from the survey. The survey itself contains a lot more details, a lot more information. We think it's very rich and has a lot to say, but we're happy to share with you these highlights. So next slide, Melissa. So the first thing we're going to talk about is what we're calling the transportation landscape for riders. And this is what the respondents to the survey told us about transportation in their communities. So next slide. And now I need my glasses. So older adults and people with disabilities use transportation services, and this is no surprise to anyone on this call, for a lot of different reasons. And many of the reasons that they use transportation are essential to support community living. If you look at the bar graph on this slide, you'll see that The main ways in which transportation is used is for healthcare, followed very closely by grocery shopping, going to the pharmacy to get prescriptions filled, for example, to access social services, and finally, in that top list, nutrition, restaurants, and meal sites. Next slide. For those who don't drive, finding alternative transportation is difficult, according to 77% of the agencies who responded. And the difficulty is strongly related to affordability. As you can see on this slide on the right side, 49% of survey respondents said that they felt that finding alternatives to driving was difficult related to the affordability of available options for older adults and people with disabilities. Next slide. Only a quarter of our respondents say that transportation options are good in their community. And only a third, 3% say that those options are very good. Less than 1 in 5 say the options are highly affordable, and fully a third say that they're not affordable. So Carol, next slide.
Thanks, Virginia, I appreciate it. Next slide, please. So our second main point that we're going to talk about are the transportation service agencies that are represented in this survey. Next slide. So when we look at the agencies, nearly a third of the organizations describe themselves as public transit agencies. And as you can see by looking at the different categories that are represented on this slide, most are county or regionally based. You can look at the chart to see the breakdown of the types and who completed the survey. So you see that the majority of the people were from public transit, and the majority represented either a single county or multiple counties. Next slide, please. Most agencies offer rider assistance, and you know that because most of you represent the same kinds of services of the people who filled out this survey. But most commonly, assistance with that they provided was with embarking and disembarking. About a third provide more personal assistance. 94% of the agencies provide rider assistance primarily for getting off and on the bus and use of the lift or a ramp. Next slide, please. 3/4 of the organizations serve both older adults and people with disability. Of those groups, 68% are for people 60 and older, and 48% are for people with disabilities. Next slide. A majority of those who serve people with disabilities are providing rides for people who use either manual or power wheelchairs. Of the people with disabilities, 80% serve people who are blind or have low vision, and 77% serve people with intellectual disabilities. Next slide. Roughly equal portions of the agencies provide services 5 days a week, every weekday or specific days for an average of 12.8 service hours a day. We were really pleased to see that while far less than the number that provide weekday service, the majority of those surveyed do provide Saturday service, and 36% do provide rides on Sunday. Next slide. Virginia? I'm sorry, and one more. Most agencies offer free or reduced fares, most commonly dependent on the rider's age or disability. 85% have specific criteria for riders to receive these lower or no-cost fares. Now, Virginia.
Okay, thank you. So now we're going to talk about service funding, a subject that is always near and dear to our hearts when we're talking about transportation. Next slide. As you can see, most agencies that responded say that they receive funding from several different sources. Primary sources include state funds, FTA Section 5310, and Older Americans Act services. But you can see there's great variety. And next slide. So this slide is very interesting. We just fell in love with it, actually, because I think it illustrates beautifully the large number of sources that are necessary to patch together in order to fund transportation services in many communities. We found that between 5 and 11 sources of transportation are used by the respondents to this survey, which is quite a feat to patch all those different ways of funding together and ensure that you're following all the rules, et cetera, to ensure that you're providing a comprehensive service for older adults and people with disabilities. Carol?
Our fourth main point that we're going to discuss today are the communications and marketing piece of the survey. Next slide. 2/3 of the agencies that we surveyed have a public awareness campaign, which is great because that's the way that they can get their word out to the public. They utilize a wide array of channels to reach their riders, including both passive types of advertising and active. The top methods that the agencies use to promote their services and to educate current and potential riders include their website, participating in community events, passing out flyers or posting them places, social media, and speaking engagements. Next slide.
And so now we're going to talk a little bit about drivers and driver safety training. Next slide. So we found that the majority of agencies exclusively use paid drivers, and those that use volunteer drivers are significantly less likely to provide formal driver training. We also found that 57% of the transportation providers that we surveyed use only paid drivers. 21% use actually both paid and volunteer drivers, and 16% use only volunteers. Next slide.
Our sixth area is dealing with interagency service area coordination. Next slide. Most agencies coordinate with other service providers in their area, resulting in a somewhat coordinated network of transportation services. While 65% of the agencies stated that they coordinate with others, only 15% said that they were coordinated, and 29% said that they were not very coordinated or did not coordinate at all. That leaves a lot of room for improvement. Next slide. 32% of organizations have a mobility manager position. 60% do not have a mobility manager, and of those, the majority do not expect to add one. We think this is pretty significant because we know that when there's a mobility manager involved, more people know about the service options that are available to them. Next slide.
And now we'll talk a little bit about service challenges. So nearly half of our respondents maintain data on unmet need requests, which are most frequently related to hours or service area. But many also limit access based on trip purpose. The highest ranking unmet needs included, and these again will not surprise anyone, weekend and evening service, rides outside of the service area, and finally, trips to social or religious events. Next slide. We gave our survey respondents an opportunity to talk to us and to give us off-the-cuff remarks about things that they felt were important. So one of the questions that we asked, and we made an open-ended response, was what barriers does your organization currently face in offering services? As you can see, these are a variety of barriers. One respondent said, we're trying to provide 2020 service demand with 2013 funding levels. Our staff have not had raises in 5 years. No drivers or staff that want to work on weekends. A lack of accessible vehicles and trip software. Not enough volunteers or lift-equipped vehicles. And finally, a lack of coordination with local social services agencies. Next slide. So the top 3 unmet need requests are fairly evenly distributed between limitations by trip type, service area or distance, and finally, hours or frequency of service. Next slide. And again, in their own words, what requests for service type or for services have you received in the last 2 years that you have been unable to implement into your transportation program? And these include long distance trips, which are found to be cost prohibitive, night and Sunday service, additional service to rural areas, many requests for transportation to things like shopping, nutrition, socialization, court appointments, and other issues, paratransit service to a different county, and finally, people without Medicaid needing rides. Next slide.
We looked at future opportunity and impacts as we were getting toward the conclusion of our survey. Next slide. And again, we allowed people to tell us what their thoughts were. We found out that transit agencies remain optimistic, which is great news. When asked what their agency's biggest opportunity might be over the next 12 to 15 months, survey respondents said, diversifying funding sources that will allow us to serve individuals that are not elderly or disabled, that need transportation assistance, especially in the very rural counties. Fundraising for staff positions to grow and maintain volunteer driver availability. Expanding the number of vehicles. Coordinating commuter service from another city within the county. Expansion of hours to Sundays. Next slide.
So we had the opportunity to look at the responses that came from organizations that received Section 5310 funding, as well as those that don't. So we were able to make a comparison on a few items. Next slide. First of all, we found that 5310 funded organizations are more likely to provide assistance with boarding and usage of mobility devices. In fact, 96% provide rider assistance that includes helping passengers on and off vehicles, using a ramp or lift, and securement and mobility devices. They're also, that is 5310 providers, are also more apt to provide door-to-door service. Next slide. So agencies funded by Section 5310 are more likely also to have a mobility manager. And just a word, I'm sure that most of you all are aware that Section 5310 is that federal funding source of funding that focuses on meeting the needs of older adults and people with disabilities in the community. And that is a particular concern of the NADTC. It has been historically from the very beginning. And we certainly try to work with organizations to get 5310 funding if they don't have it already, which is why we really wanted to spend a little bit of time talking about Section 5310. And I think this finding about mobility managers, as Carol said, it's really important to have a mobility manager if you're going to have easier access in the community to information about the variety of transportation options that may be available. Next slide. And this is our last report out slide. And this is another way in which we compared Section 5310 providers to others. We asked about coordination, and we found that coordination with other providers is much more likely to happen among 5310 recipients than it is with other agencies, though of course we all recognize the value and importance of coordination. So with that, I'm going to ask Melissa to give us the next slide and to review asking questions. I only see a couple in the chat box. So I just want to say that we're interested in questions as well as comments. So we welcome any feedback that you might have with us. So Melissa, you want to
Sure.
review instructions?
Certainly, Virginia. So as Virginia mentioned, please submit any questions that you might have or comments into the Q&A feature at the bottom of your screen. And we'll just read those aloud and allow our panelists to address them. So we do have the first question. Did respondents identify any funding sources from other federal sectors, for instance, the CCAM work?
I think one of the slides, and if we can find it here, that had all the funding sources. I think that's in section 3. Hold on, Melissa, I'll tell you which slide to pull up.
Okay.
Yeah. I think it's 19, slide 19. No, maybe the one after that. Yeah, next one, that one. So you can see all the different sources of funding that the provider organizations that responded identified that they use. They include Section 5311, which 28% of the respondents use, and then 5307, which is used by 13 of respondents. I think to some degree, the respondents to the survey are a subset of transportation providers. They are those providers that do significant service in meeting the needs of older adults and people with disabilities. There are lots of other provider agencies that are, for example, fixed route public transit or demand responsive public transit, who are serving those populations, but they may not be the focus of those populations. And so I think those folks that really consider older adults and people with disabilities more likely as a critical part of the service entities that they serve, were more likely to respond to this survey. And Carol, I don't know if you wanted to.
Yeah, the other thing is Older Americans Act, we always point out that that's a significant source of funding for many of the people. For 26%, it is their primary source. Right. And as a part of all of the sources of funding, it ranks as 36%. And so that's certainly a significant portion of funds that come from non-FTA or Federal Transit Administration, USDOT funds. And so that's pretty significant. I think we were really pleased to see at the amount of state funds that people were getting to support their transit services. It was a nice discovery to find out that there was such a high percentage of funds that were coming from the states. Mark, do you have any comments on that?
Right. You're on mute, Mark.
There he is.
Sorry, all that to say you've covered it.
All right.
Well, that's good to know.
Another question, did you ask agencies to provide examples of coordination?
I think we do have a little bit more.
We did ask agencies to provide examples, and we clustered the examples or the comments that they gave us. So I don't have the examples right in, specific example in front of me, but we can see that individuals, a good portion, 39%, said that they coordinate services generally across the agency. Some people talked about holding meetings and attending coordination meetings within their areas. They also talked about referrals and referring riders to other agencies based on the situation and the need. So people gave examples along that line, how they coordinate. They also talked about giving general guidance and answering questions and providing advice to people who are seeking information and they may not, the agency specifically may not provide, but they can reach out and help acquire the kind of help. And those are, there are also some conversations or examples related to training activities and coordinated training activities that are coordinated. Those are the big buckets of content that the respondents talked about, ways that they coordinate.
Again, I would really encourage you to look, all of you have access to the actual survey results. I would really encourage you to dig into them. It was really difficult for us to pare down what we shared with you today. We started out with about twice as many slides, and we wanted to make sure that we had time to answer your questions. And so make sure that you go to the survey itself, because there just really is a large amount of information that you can get on a lot of those questions in terms of answering a lot of your specifics.
Okay, another question, and I think you may have addressed this a little bit in the previous answer. Someone wanted to know that it would be interesting to learn whether the respondents use funds from other federal agencies like ACF or DOL. I'm not sure what those acronyms mean. I know we have the funding sources slide up now, but I don't know if this is a point of maybe drilling down or parsing out some of this information to find that out as well.
Well, this was a multiple choice survey, and we did give people a wide range of choices. And I think, Mark, if I'm not mistaken, they were able to identify what other sources would be.
Right.
And this slide really identifies those that, where there's at least a significant percent, or at least 3% of their funding was used in gaming, for example. So I don't think we had DOL. We did not have DOL listed, and I can't remember what the other agency was. So
ACF.
Yeah.
Next question. Section 5310 requires a matching contribution. NEET has been fortunate to use our volunteer driver hours as a match. Are others aware of this by chance?
I hope so. FTA, CCAM just came out with their grading guide, which is available on their website. And I would urge folks to take a good look at it because they identify ways to use other federal dollars to support your program. And, we know that match is a significant issue in many communities.
Great. A question from Julia. How do you see this data being used and by who?
Well, shall I start?
Yes. Yeah.
Well, I think I see this data in a couple of ways. One is from the perspective of NADTC, we find that this data is very helpful in helping us figure out where there are opportunities to provide technical assistance, where there are issues that we might want to address in future grant solicitations, et cetera. So we see it as helping us identify priority areas that need some additional work. But we hope, I think my vision is that local agencies should really take a look at this and compare their own community situation with what this survey reveals. The survey reveals, I think, bottom line, that there is a huge need for funding, that there is a huge need for diversifying funding, that the whole issue of lack of transportation at certain hours of the day and on weekends is a big issue, as well as being able to cross the distinct boundary of where the transportation program sits. And we know that, we've heard that anecdotally for years. We know that that's important. I think just having this kind of data to reiterate that is really powerful and hopefully can help you in your work, in your community, to make the case for additional resources to meet particular kinds of needs. So Carol, you want to add to that?
Yeah, I especially want to add on to your last comment. I really think that this kind of information is key when you want to go to your county commissioner, you want to go to your city councils, you want to engage lawmakers, maybe on the state level, to say, look, here's where we are. This is where the majority of people who are like us are. And we would like to make sure that we up our game so that we can meet those needs that we see others are already meeting. It's especially true for those who don't have the mobility managers, for those who are not currently coordinating, for those who are not providing weekend service. They have some ammunition now to be able to engage their influencers, and especially the influencers with funding, to gain additional support for being able to do some of the things that they haven't up to this point been able to do. And so we think that's really important. We also think it's a way for some agencies to be able to kind of blow their own horn and say, look, out of all the people in the country, we're on that top level of providers in terms of where we sit. We are coordinating. We do have a mobility manager. We are providing weekend service. Look at where we fall. And I think it works on both ends.
Thank you. Another question, are nonprofit agencies providing service to other nonprofits? Is vehicle insurance an issue when an agency transports a passenger from another agency?
I'll be glad to take that on. Vehicle insurance many times is an issue. We're working really hard to have it be a non-issue. There's a lot states can do to make sure that some of those things are not prohibitive so that people can coordinate better. So lots of times if you can start with, at the state level with your insurance commissioner, that's a good place to be able to start. We know that people use insurance as a problem all the time, but sometimes when they get their insurance agency and the other player's insurance agency together, as long as their coverages are very, very similar, it really doesn't seem to be the blockage that people make it out to be, because one insurance says, oh, I'm not going to cover their people. Most of the time, it isn't the problem that you think it might be. So there are ways around that. And it's certainly something that you should explore, because I think there's been a lot of work done in that area.
Wonderful. Can Older Americans Act funding be combined with 5310 funding? How does an agency apply for Older Americans Act funding?
Okay, I'll try to address that. First of all, yes, you can use Older Americans Act funding and 5310 in a program. But there are some differences. And one difference is that you cannot charge for rides under the Older Americans Act. You can accept contributions, but you cannot charge for rides. So, but there are situations where if you combine it, you can serve a wide swath of population. You can serve those people who really have a very low income, and use your Older Americans Act funds to do that, and then institute a sliding fee scale. It is possible in some programs that are funded by the Older Americans Act to institute a sliding fee scale. There is a process for getting that approved. And as for how to get Older Americans Act funds, the way in which Older Americans Act funds are disseminated is they go to the state level, and then they are disseminated, assuming there are area agencies on aging in your state, and there are in all but I think 7 states. And in those places, then there's a requirement for a plan. Those plans are renewed every 3 to 4 years. There's a state plan, and there is a local or regional plan that the Area Agency on Aging develops. That plan is developed with a lot of public participation. There are lots of opportunities to influence what is in the plan. Transportation is not a mandated service in the Older Americans Act, but it can be paid for with Title 3B funds. It is an option, and it's an option that many area agencies on aging choose. And the most typical way in which transportation is operated through Older Americans Act funds is that the funding comes to the Area Agency on Aging. The AAA, the Area Agency on Aging, then has a competition within the areas that they serve, and providers apply to be providers. And they have to meet the criteria that has been set for the program. And then they can operate the program and receive a portion of the funding. So it's federal, state, and local. And you need to know who your local agency is, and by all means, approach them.
And just to add to what Virginia said, I am originally from North Dakota, and our state was one of those states that didn't have area agencies on aging. And our state unit on aging was the place that you would go for those same things. It is essentially the same process that Virginia just explained to you, but you go to the state unit on aging. And so you just need to find out who that is in your particular state, if you're a state that doesn't have area agencies on aging, but the process is really much the same.
Right. This next one is a comment, but maybe you all have some insight for him. It says it's hard to justify the need for a mobility manager when agencies only have one transportation program. Securing other transportation options is normally left to case managers. So that's his comment.
I understand. And I see where he's coming from, but at the same time, if there is, for example, an information referral program, or any kind of organized within the community, a central place where requests for transportation are made, then I think one of the things I think that we found in this survey that was very important is that about half of the respondents said that they maintain records on unmet need requests that they can't meet. And that's really critical for growing a program, for diversifying the kinds of transportation that's available in the community. A mobility manager, part of their mandate, part of their job description is really to get a handle on where there are gaps in services. And so having a mobility manager puts you in a good position to do that. If you don't have one, figuring out another way to fulfill that responsibility. And once you do diversify, I think it is easier to justify having a mobility manager. But it's also really, really critical to have a central place where that information is collected so that you know where the gaps are and where the needs are and the needs that are not being met in the community.
The other thing that I would say to the comment is that it's fine to know that there are case managers who can help their particular clients, but we have a lot of people who require transportation and even accessible transportation that don't have case managers. They're people who live in their own homes, or they're people who live in congregate facilities, whether it be independent living or assisted living or whatever it happens to be, that don't have any kind of case manager person or building person that can help them with those particular kind of arrangements. And so then a whole lot of people fall through the gaps. So it's really important that we try to look for ways that people can access the information. You know, sometimes we think that because we have these great big buses that go down the street, everybody knows about us and they can see our name and the telephone number on the side of the vehicle. And so of course they know how to get a hold of us if they need us. But just like anything else, and unless it's you and you need it right then, we don't pay much attention. And so people don't know about our services. The people who use us know us. The people who don't, until they need us, really don't pay any attention. A mobility manager can help get that word out. And while you think you can't afford it, if they can make sure that other people know and others can value the fact that you provide a service that is really needed in your community, it's kind of a revolving circle, because then that helps build support in your community, and additional funding perhaps as well.
Okay. And we've got quite a few more questions, so hopefully we'll get to all of them before the end of the hour. This attendee says, I'm new to this. Has any direct recipient used funds from providers or contractors for local matches?
Can you repeat that question?
Sure. Have any direct recipients used funds from providers or contractors for a local match?
That I can't.
Okay, I can answer that a little bit. Certainly you can, if you have contracts, for instance, to provide services, that can be used as local match. The thing that's nice about contracts is you don't have to count that as fair income. When you have it as fair income, you have to subtract it off of the money that you get, and you can't count it toward your reimbursement from the, for instance, Federal Transit Administration. But if you have a contract, that money is yours to do with as you please. So it can easily be used as local match, and that can really help you. So if you are providing a lot of services for a nursing home, for an assisted living, for a church, maybe even for a hospital, getting people home from the emergency room, whatever it happens to be, try making sure that you use contracts to your full advantage, because those count as local match, and you can use them and be very flexible with those dollars. So it's absolutely the right idea.
Great. This question said, did you ask about any creative ways to overcome these barriers? For instance, evenings, weekends, and social are all logical requests. We need to brainstorm some suggestions.
Well, we didn't so much ask about solutions. We were trying to get a sense of challenges, et cetera, and gave people an opportunity to share their opinions about what was going on in their community. I think the solutions are very often solutions that are tailored to the community. That's certainly what NADTC has found with the grant funding that we have provided to communities over the years, that it's really important to take a look at what your particular barriers are, what your particular challenges are, and ensure that you're tailoring your response to what's going on with the community.
If any of you have some of those particular challenges, one of the advantages of reaching out to NADTC is we can pair you up with people who, if you're looking at starting weekend service and you want to know, well, how do I do that and how do I fund that? If you're looking at saying, I'd like to do evening service, but I really don't know how we would afford to do it, or how would we get enough passengers riding to justify having it. One of the things that we can do if you reach out to us is we can put you in touch with other agencies who are currently doing it, and they can tell you how they got it started, what they've done to promote it, how they are funding it, those kinds of things. And we can try to find communities that are very similar to you, and that way you can have someone who is really close to being a peer agency to work with and talk to and do some of that brainstorming with.
Thank you. And these next two questions, I don't know, you may have to refer to a particular slide in the presentation, or you may know this data offhand, Carol, Virginia, or Mark. First question, how many agencies don't receive either 5310 or 5311 funding? Both those funding sources encourage capitalization at 80% of resources. Do you all know that off?
I can answer that. I looked that up. So From the data, we see that the proportion that said they absolutely do not receive Section 5310 funding is 33%. And the proportion said that they do not receive Section 5311 is 51%. There were a proportion of people that that responded that were uncertain about whether they received the sources, but those are these individuals. The 51% were certain that they did not receive Section 5311 funding.
Okay,
And over 30% do not receive Section 5310.
great. Thank you, Mark. And the next question is how many respondents either said they had TNC availability or taxi availability versus both? Is that something that was asked in the survey?
I don't recall that. I don't recall that we
I
asked
don't
that.
recall it either. Virginia, do you?
No, I don't, but it's something that we will take it under advisement. We'll take a very careful look at the data and see what we can find.
Wait a minute. Sorry, I'm flipping through this one survey.
Please,
And
Mark.
it looks like 7% say that their organization provides taxi service.
Okay.
That's at least one thing.
Okay.
Okay, thank you. Next question, if those who responded that they did not coordinate, did the survey ask respondents about their specific barriers to coordination? Any specific barriers?
I think there is something on barriers to coordination. I think we've got something in the survey that talks about barriers to coordination, but I don't think it's one of the slides that we showed this afternoon.
No, it isn't.
So keep going, Melissa, and
Sure.
we'll be glancing through this and seeing.
Oh, okay, and if you find out what page it is in the survey, you can reference it, and everyone, if they haven't received the link to the survey, will receive it after the webinar.
Okay.
And then this is just a response to the gentleman who had the question about mobility management. One of our attendees recommended that he contact the National Center for Mobility Management to identify language that can be used to justify mobility management positions. And that was from Judy.
Great idea.
That's
Okay.
perfect. Great idea.
All right. Let's see if this is a question or comment. Let's see. Do you have something, Virginia?
Well, I found on page 43, and there may be something else in the survey, but 43 is a response to from people on how they coordinate their efforts. And they're talking about things like attending quarterly coordination meetings, informing folks about their services and appropriate referrals. This is like the role that the mobility manager plays in coordination. But it's not specifically about barriers to coordination. So I think there's somewhere else in the data that we talk about barriers in general. But I'm not sure. I don't think that there's anything that specifically drills down to barriers to coordination, but we will take another look.
Okay, thank you. Just a comment from Rochelle. We have leased our vehicles to other agencies to provide services, as well as created incentive programs for the agencies to provide weekend and evening services. So probably just an example of practice. Yeah.
Great.
Next question. Did any of the large complex metropolitan areas, for example, Chicago, New York, Philadelphia, respond? And did their responses differ from other areas?
Mark.
Yes. I was just looking at that. So I can't say offhand whether Chicago, New York, or specifically responded, but we had a good response from highly urbanized areas. So I'd be surprised if we don't have that group in the study. In terms of differences, there are differences depending on that's one of the key variables where there are differences, has to do with urban versus, and especially versus rural, that where the services are more, there are fewer of them, and coordination is more complicated. That's all I have at the top of my fingertips right now, but it's a good question.
It is a good question, and something that we'll see if we can find something additional to share on that issue.
I know one of the challenges that people talked about was was especially related to rural areas and people who are not within the routes, the service routes, and so how to manage that challenge. People talked quite a lot about that, but I think the challenges in the rural areas stand out as more sparsely populated or more complicated.
Okay, so we're getting close to the top of the hour. I've got one comment and one final question. So a comment I think was in response to a question earlier on about CCAM. Someone commented, the Department of Health and Human Services, the Administration on Community Living, and the Department of Labor are all represented on CCAM. So that was just the comment.
They are, and they are all part of the braiding that Virginia was talking about. So it's really important to look at those documents.
And the final question, with 77% reporting difficult with the same 3 barriers, this is not new news. Most consumers are dissatisfied. It appears most areas need more drivers on weekends and evenings. A recruitment seems to be in order as companies such as Lyft and Uber have popped up and seem to be able to have drivers. Maybe a reorganization of how the service is organized, make it a run like Uber or Lyft, or is this purely financial?
I don't believe it is purely financial. I do believe that it's time for us to look at some new models for transit. And I think this is one time where COVID-19 and the pandemic that we have been experiencing now for the last large number of months, and looks like we're going to be experiencing for the foreseeable future, it's where it gives us some opportunities. One of the things that is an opportunity that comes out of this is, anytime we've ever tried to change our routes, our fares, the way we do things, we get a lot of pushback because people don't like change. But during the COVID-19 situation now, people expect change. People know that there are ways that we're going to have to do things differently. So if you are looking for an opportunity to test a new model out, to see how you might do your service differently than you've done it in the past, now is the time to do that test. I think people are going to be much more accepting of changes in your system. I think that you can give things a trial run without getting that same pushback that you would have before. I think you're operating with a lot fewer passengers right now so that you can experiment a little more. It won't tell you how many passengers you're going to have on that service, but it will certainly tell you if you can make something like that work. And so now is the time to kind of test the waters, so to speak. And out of chaos, we can really find some opportunities as well. So I would really encourage you, if you want to see if that's something that would possibly work for your system, now might be the time to try to implement some of those things.
And I would only add that NADTC in the next couple of months is going to be publishing a compendium of best practices. It's based on our grantees' experience, and One of those best practices is on providing evening and weekend rides. And it is an organization that is already providing a demand responsive service in the community. So that should be worth taking a look at. But I can only reiterate what Carol said, because I think she's very right that now is the time to really look at your system and identify ways to make it more responsive. And that's especially true for services for older adults and people with disabilities. I think we really need to think outside the box and find some creative solutions that we may not have even dreamed about before. So with that, Melissa, there are no more questions, is that right?
We just had a comment and one question, but the comment was regarding the Lyft and Uber question, saying that there are federal grants that are not available if providers use Lyft or Uber because they're not always accessible. And I think many of us know that. So they're, it's not a one size fits all type of deal. And then one last question, someone asked, where are people wanting to go during weekends and evenings?
Well, interestingly enough, one of the things that this program that expanded to evening and weekends found is that they had a lot of folks getting kidney dialysis who needed that transportation on Saturdays. But also, once COVID-19 is over, I think people might still want to go out and meet with friends or go to houses of worship, etc. All the things that make life worth living. And hopefully we're going to get to that someday, sooner than later.
You bet. We call it living a spontaneous life. The rest of us go out and get on our cars whenever we want to go somewhere, and we don't give it a thought whether we can go to the grocery store and get something that we've just run out of. So it's living a spontaneous life, being able to do the things that the rest of us take for granted.
Absolutely. So with that, we will get ready to close. We would be remiss to not give a special thanks again to Mark Richards and his team at KRC Research for all the wonderful work that they have been providing for our last two national surveys. So I thank you, Mark, again for participating in this webinar. If anyone on the call is interested and wants to contact Mark or his team, their contact information is provided here. And as a reminder, these slides and this recording will be provided following the webinar. And that is our contact information at the NADTC. We welcome your calls, your emails. If you have any questions, technical assistance needs, please don't hesitate to contact us. Again, thank you so much for this afternoon and being with us. And we hope that you have a wonderful rest of your day. Take care.
Thank you, everyone.
Thank you.